Everyone, and welcome to this week's office hours. We've got a great presentation for you all today, and we'll get to that in just a moment. We're going to spend just a couple moments going over some tech notes and housekeeping reminders for all of us today. So first and foremost, we are recording the office hours today as we do each week, and we'll go ahead and post a copy of the recording along with the slide deck on the HUD Exchange. Just please give the team a couple business days to get that content there. It'll be up on the link that is on your screen right now. We hope that you don't have any audio issues today, but if you do, you can switch over at any time to your phone audio by dialing in the numbers that are up there on the screen, and that'll be in the chat in just a moment. The phone connection tends to be a little better. Participants are going to remain muted for the duration of the office hours, but we hope to hear from you throughout in the chat feature. So please send all questions, comments in through the chat. You can look down on the bottom right-hand side of your screen. You'll see the word chat and what looks just like a message bubble. If you click on that, it'll open up the chat functionality for you. When you are sending in those questions, comments, or feedback in the chat, just go ahead and take a moment to make sure that they are going to everyone. It should default to everyone, but if it doesn't, just take a moment to scroll down on the list that's on the right-hand side of your screen. And with that, I'm going to turn things over to Norm Suchar from HUD's Office of Special Needs Assistance Programs. Norm?
Thank you so much, Natalie, and welcome everyone to the office hour session today. We have a great presentation that we're super excited about from Chicago. So we'll get to that in a few minutes, but I want to introduce our presenters. I will say we have a fairly short agenda for today, so it won't be as long as usual, but if you have questions for us, please feel free to type them in the chat window, and we will try to answer as many of them as we can. So as you can see on the slide here, we have several people from the SNAPS office ready to help answer questions here. But our featured presentation today is from Chicago, Illinois. Christine Riley and Chandra Libby from the Department of Family and Support Services are going to present about some of their work on housing people from hotels. So we're just super excited about that, and I think you'll all find it that they've just done an amazing job. We will also have our regular Centers for Disease Control and Prevention update. Ashley Meehan will be delivering that update. We haven't had an update on our ESGCV spending recently, but we will have an update on that today. Sharon Singer is going to give us that update. We do have a poll today. So before we go to our first presentation, I just want to let everyone know that there will be a poll question. We'll post the link here in a second that you can go to answer the poll question. The question is going to be, how is your community addressing an increased need for isolation and quarantining? And there will be several options there for you to select. So it always helps us to get an understanding of how things are going. So please, sometime during this session, jump in and fill out those poll questions or that poll question, and we will discuss the results a little later on today. So with that, I'm going to turn things over to Ashley from the Center for Disease Control and Prevention, CDC, and Ashley's going to give us our COVID update. Ashley?
Thanks, Norm. Hi, everyone. My name is Ashley Meehan, and I am a health scientist with CDC's homelessness unit within our COVID-19 emergency response. So welcome. If I have not presented and you are on for the first time, so welcome. Next slide, please. Thank you. So this is what we're looking at in terms of COVID-19 cases over time. The red line shows the 7-day rolling average, and those blue bars are the daily cases. So it looks like we may be reaching our peak for the current Omicron surge this week. But again, we're going to keep an eye on that. You know, it might spike back up next week. We don't know yet, but hopefully that is our peak and things will start coming down. The 7-day case rate has gone down since I presented last week. So that's a good sign. And we're going to hope that it continues to track in that direction. So yeah, hopefully we're moving down. Next slide, please. And then when we're looking at deaths over time, again, just as a reminder, I've said this before, but just want to reiterate, this will lag behind cases a little bit, just because it doesn't happen right away when cases are identified. But we have yet to see a huge spike in deaths from this surge. Of course, any death is not desirable. So would love to see this get down to 0, but luckily we have not seen a huge burden of deaths yet. So that's still looking good for now. Next slide, please. Just briefly want to recap how quickly Omicron has taken over the percentage of COVID-19 cases that we've seen in the United States. So from December 4th to today, it has rapidly comprised of most of our COVID-19 cases. And I just want to reiterate that this is determined using genomic surveillance. So CDC has a national genomic surveillance system that collects SARS-CoV-2 specimens for sequencing. And there's a couple different programs where that gets reported to and analyzed. There's a national SARS-CoV-2 strain surveillance program, and there are some contracts with commercial and academic laboratories that are contracted by CDC and state or local public health. So that's how we keep an eye on this this breakdown, and that's where these data are coming from. And that information is all on the website that is hyperlinked in the PowerPoint slides. It's been in the previous slides as well, so if you're hoping to take a look at it now, you can go grab that link there or in the chat. I think Letitia put it in the chat, so thanks, Letitia. But yeah, just want to emphasize most of what we're seeing right now is the infectious strain of Omicron. Next slide, please. And that's really it. You know, I know everyone's feeling the weight of a lot of different things right now, and I know you all are working really hard. So we'll leave it there and be open to some questions.
Thank you so much, Ashley. Just encouraging to see the line change directions and start going down. So hopefully that continues. If you have questions for Ashley, please feel free to type them in the chat window, and we'll try to answer as many of these as we can. So we're going to move on to our next presentation. I'm very delighted to introduce some of our partners from Chicago, Christine Riley and Chandra Libby. So I'm just not going to say much more. I'm just going to turn it over to you all and let you just take it away from here. So Christine, over to you.
Thank you very much, Norm. Thank you, everybody, for having us here. As stated, my name is Christine Riley. I'm the Director of Homeless Prevention Policy and Planning with the Chicago Department of Family and Support Services. And we will be presenting on our, oh my goodness, almost 2 years of this, what we've been going through with the COVID-19 pandemic and the successes that we've had in different areas. And I am joined by Chandra Libby as well. She will be able to introduce herself at the beginning of her slides. Next slide, please. So I wanted to give an overview of how it started. As most of us know, it was pretty quick. We at the Department of Family and Support Services, just to give you a little bit of background, we fund the majority of the shelter programs within the city of Chicago. So there's a total of about 4,000 programs, 4,000 shelter beds in Chicago. And prior to the pandemic, we funded 3,304 shelter beds of those 4,000. So when the pandemic first hit, we started having conversations with our Chicago Department of Public Health, and under their guidance, we had to decompress our shelter system. So under that decompression, we had about 20 programs who were of congregate settings, and we literally had to pull a lot of those residents and clients out of those shelter programs into alternate sites. I remember that first week, not knowing what to do, but within first 5 days, we set up 3 alternate shelter sites at through YMCA partners, Salvation Army sites, etc. The Chicago Department of Public Health also created a health screening tool for our shelters and outreach providers. Under Chandra's leadership, outreach providers were out there with the unsheltered, performing the screening tool to see if there was any symptoms that they had, etc. And all of our shelters were mandated to do screening tools on everybody within the shelter system. We began weekly webinars with our shelter partners as well as our other partners that we funded. And we opened it up to other agencies that we did not fund. And these weekly webinars included ourselves and the Chicago Department of Public Health. Um, During this beginning process, there was a lot of partnerships that were created. Healthcare providers had already started talking with each other about how to prevent the spread of COVID. And then city partners were already talking. So we came together and it was amazing work where we were able to coordinate efforts. And then our shelter providers, of course, played a key role. There was a creation of an isolation facility at one of our shelter sites, which had a large facility. So we did, I remember going on site visits to see what was needed. In a different area of their building, they were able to create an isolation facility that's still around today, which has helped tremendously. Um, and then there was the realization to further shield high risk residents in congregate shelter programs. So, and that's where the next step of Hotel 166, which I'll be talking about, came about. Because of these congregate settings over different programs with congregate different agencies who had congregate settings, we really need to figure out a way to work with a hotel partner, and that was through our Department of Housing here in Chicago. They had already created relationships with hotels and actually pinpointed a hotel that was willing to serve this population. But as you know, CES is a priority and mandate in our continuum. So we actually had to go to the board of our continuum and our CES group and change prioritization because we knew that housing on the back end was going to be important and that we had to change some things in order to house people who were at high risk for COVID-19. Next slide, please. So I'm giving credit. This is not a slide that I created, but Lawndale Christian Community Health, Lawndale Christian Health Center is a partner that, in a partnership that we developed with the city who created a complete PowerPoint slide. I just have a couple slides of their agency. They were the healthcare agency that provided guidance, provided coverage, healthcare service at Hotel 166. This is a picture of some of the residents who stayed at Hotel 166. One of the men in the picture is Dr. Tom Huggett. He's the one who has spearheaded this. He actually moved into the hotel. I'm telling you, people, this was an amazing project. He moved into the hotel to be with the residents every day. So as you can see, the April 2nd to September 30th, September 3rd was the time frame that we were at the hotel. And again, this happened really quickly. Next slide, please. These are some of the partnerships that were developed. And so we had the mayor's office involved, public health, our department, family support services, housing, our continuum of care, all Chicago, who is our lead COC agency. Charge is a group of healthcare providers, shelter providers, and advocates who came together to discuss how healthcare and shelter can come together. Again, we had our healthcare providers, UI Health, University of Illinois Health, Rush, Lurie's, shelter partners, the hotel, etc. So wanted to give kudos to all of those partners. Next slide, please. So the numbers, just so you know, a total of 259 people walked through the doors of Hotel 166. And as of September 28th, 133 of those were housed. The Expedited Housing Initiative, which I'll be talking about in some slides later, was created during this time to house those who were at Hotel 166, as well as further throughout our shelter system. So as you can see, Expedited Housing Initiative, 62 people were housed through that initiative. Permanent supportive housing, we were able to place 34 people. Bridge units, temporary units before they moved into their permanent spaces, 8 people. Through the Chicago Housing Authority, 7. Through our diversion process, 4 people were reunited with their family or friends. 6 of them went to specialized rehab facilities, and then 12 actually arranged their own housing. The remaining 126, as you can see, went to recovery programs, COVID isolation at some point, and they never came back, or self-discharged. Next slide, please. Some of the lessons learned So acting quickly. I mentioned that this was, all of a sudden, I think all of us were caught off guard and had no actual plan in place. So within the week, Lawndale Christian Health Center actually met with our Chicago Department of Public Health and started thinking. The Department of Housing was pulled in and said, "Hey, we have a hotel who's willing to house these participants." So acting quickly became very important. The first meeting with Lawndale and the health department happened on March 27th. And as you can see, the first residents moved in on April April 3rd. So totally amazing. Being flexible is important. There was an ability to change the way the actual shelter was run, and finding out different things about the homeless population. Lawndale Christian Health Center was not homeless based in the beginning. So there was a lot of things that they learned about the homeless populations and some of the barriers that they faced. Um, Also, in regards to operations, transportation to isolation facilities, how was meal delivery going to work? Laundry. So being flexible and getting all of that was very important. Also, guest support to maintain shielding. So it was very important in regards. I'm sorry. Go ahead. Did someone say anything? Oh, I'm sorry. So guest support to maintain shielding. It was very important for the Lawndale staff to understand what the guests who were staying at the hotel needed, and so that they wouldn't try and go in and out of the hotel. Because again, we wanted to shield them from possible exposure to COVID-19. So the hotel staff made sure that they had cigarettes on hand. They made sure that they had snacks on hand. They made sure that their food was brought to each room for the clients. Again, this was very important. Um, Staff supporting each other. As you all know, this was very stressful and still is very stressful for a lot of healthcare providers who were on site. So they would have support groups for each other. Lawndale Christian Health Center led prayer groups for each other. And just having that support and being able to talk about their, how they were feeling. They really were open to them expressing how they were feeling. So that was really good. Also, the on-site being on site was crucial. As I mentioned before, Dr. Tom Huggett, s- he lived there last summer, pretty much. Not pretty much. He lived there. He moved into a room. There was 24-hour coverage. There were constantly doing rounds with the residents, so they saw them every day. As we all know, sometimes with some people in the homeless population, they may not be as neat. So they had to check in on the rooms to see if there was any damages, making sure their medication was had, making sure no one had, unfortunately, if there was an overdose. But there was making sure that touch point was done every day and that on-site presence was created every day. And it made the actual residents who were staying there feel comfortable knowing that they had somebody there checking on them every day. Unsettling the racial quo was very important as well. Um, it was about, at that time, the George Floyd murder happened. Lawndale Christian Health actually led conversations with some of the staff because the city was at unrest. And they really provided them, and this was in downtown Chicago. So that's where a lot of the protests happened and so forth. So having that conversation about, the civil unrest that was happening right outside of their doors. There was some looting happening right outside of the hotel doors. So really having those conversations and understanding the injustices that were happening and the inequality that was happening in our city at the time and in our nation. Um, Hearing guest voices was very important. They would listen to, while they were doing their rounds, listen to the residents and talk about what their needs were. They were able to do so many um, o- um, um, I'm sorry, diagnoses finding out different screenings of different issues that people had that had not been diagnosed before. And again, that goes back to that on-site presence, being able to diagnose diabetes, hypertension, and different healthcare issues, and being able to treat them or prescribe prescriptions. Um, and also a lesson learned is, of course, that we all know housing is complicated. It's not easy just to house someone who is homeless. You need to make sure everything is in place. So they worked with resources through our continuum of care, as well as with the city, to make sure those who were going to be getting housing had the proper identification, the proper documentation, the proper medication when they left. And again, looking at intensive guest support um, was very important. Making sure that again these diagnoses were carried with the case manager who provided the housing services to them, so they knew what was going on. Again, it was about the partnership. And again, the will to change. And I'm sorry if I'm going too fast. I know there's a time frame, but I want to get through everything. The will to change. So the COC with our change in the CES prioritization change. That was about being flexible. The hotel partner who had never opened their doors to a homeless project like this, there was a will to change. The city in general, and our healthcare providers, our city departments, there was just a will to change. So we were very grateful for all of these lessons learned. Next slide, please. So now I'm going to talk about from Hotel 166 to the accelerated moving events. Next slide, please. So as I mentioned earlier, there was a piloted program in June of 2020 at Hotel 166, but it officially launched in October 2020. To date, there have been 40, almost 48 events held. Also, 93 of those engaged households apply for units at the AMEs. And AMEs are those events that go from, they went from the Hotel 166 now to unsheltered AMEs, which Chandra will talk about, and then to our different shelter locations within the city. Where case management comes, case managers, we have housing liaisons that work with clients who are of high risk and do the applications. They may have landlords on hand. They already have units, housing units lined up, and people can apply for and sometimes get approval right there on the spot. As of January 10th, last week, we have housed since this launch in 2020 1,308 households. The city of Chicago, our Department of Family and Support Services, invested $35 million into this initiative. So with that, we were able to fund the Expedited Housing Initiative, where these accelerated moving events. So it was about partnership. We are funding right now All Chicago, who's the manager of the Expedited Housing Program, and through CARES dollars, we were able to invest $35 million. 10 of those events, the AMEs, are dedicated to unsheltered populations. And as of January 10th, approximately 211 unsheltered households have been housed. Next slide, please. So what does the process look like? So before the AME, the team works with the actual shelter staff or the outreach staff to identify a location for the site, for the event to take place. Again, it's based on high-risk data that's already within HMIS that has been collected. And then you work with the selected site, the shelter or outreach site, on the list of participants. So it's up to them to make sure that there's proper documentation, proper identification had. So when the AME comes to the location, there's no barriers to that housing opportunity. Also, there's a distribution of information for staff and participants so they know exactly what this process looks like and what will be going on. During the AME, so when the day when it comes, there's information taken and intake. As I mentioned, there's a Chicago Rents arm of the Expedited Housing Initiative that's solely based on finding available units and landlords to participate in this. So at the AME, there's actually unit selection and application to that unit. And then they have a meeting with the Chicago Furniture Bank to actually pick out their furniture for this apartment. The goal is for when people move into their units, it's already furnished. They already have move-in kits. They already have that first step for a successful life and next phase of their journey. After the AME, there's an assignment to a housing liaison to assist in that housing process and follow up. So of course, once they apply, pick out furniture and so forth, they continue to meet with their housing liaison to answer any questions, to let them know when they're leasing. Their lease signing will be if there's a site visit to the apartment, they arrange for that and transportation, any additional documentation that may be needed. That happens after the AME. And then it's communicating with the site, the shelter, or the outreach team who's working with that individual about the participants who apply for a unit. So communication in this process is key so that the actual client who's going to be housed has the information that they need, and also the shelter or the outreach partner understands what the next steps is. Next slide, please. And then I think I'm going to pass it along to Chandra now with AMEs on a focus on unsheltered population.
Good afternoon, everyone. Okay, so I'm Chandra Libby. I am the director for the Homeless Outreach and Prevention Program. I just wanted to kind of start with a little bit of information on my program itself. Next slide. So, the city of Chicago started a homeless outreach program specifically with the focus of working and finding homeless in the street and identifying where they're located and connecting them with the services. All of this occurred somewhere between the middle and the latter part of the 1990s. I currently have on paper 4 teams, and that's a two-person team each. So that's a total of 8 outreach workers. However, due to staff leaving, staff going on medical, I'm currently working with just 1.5 teams, which is 3 people for the entire city of Chicago. So needless to say, I'm depending a lot on a lot of our delegate agencies that we found to help us to kind of make sure we can do full coverage of the city. Some of the things that my teams are responsible for outside of just the unsheltered homeless is that we have to participate in homeless cleanings to make sure that homeless personal items are not disposed of, and their tents are not disposed of, and just things that they, should not have in the streets that are removed. We also do encampment initiatives where we kind of choose a homeless site and then we inundate the location with as many social service assistance that we can, such as treatment, case management, mental health. We have a physician on our mobile health unit who also works at all of the campsites and doing the initiatives with us. We're responsible for vacates, for evictions, and vacates and evictions are pretty much people are being displaced from their homes. And so we try to go in before all of this occurs to kind of help them make a plan as to where they can relocate, as well as try to assist them in finding some resources to help with that relocation. And then the last thing is the pit count that we do once a year, which is coming up next week. Where my teams are responsible for participating in that. And the reason I included this is because to just kind of lead into why we were chosen to assist with the unsheltered AMEs. Throughout all of the work, I've been with the city since 2008. And throughout all of the work that we do with the homeless, I've been able to kind of accumulate a list of all of the homeless locations throughout the city. Sometimes they, as you know, everyone knows homeless are transitional. So sometimes things change, locations change. So annually, I have to keep an update. I have to keep these sites monitored and make sure that they're still viable, or if there are new ones that have occurred. So that's pretty much the reason why we were asked to participate with All Chicago for the unsheltered AMEs. Um, I was originally approached in September of 2020 to start the planning process for the unsheltered AMEs. And so it just really got to the point where I had to figure out, well, how can I do this with people who are living in the street? Prior to that, we were doing a lot of testing for COVID um, with different organizations, with public health, um, and with some of the hospitals here in Chicago. We were trying to get people tested. We were trying to, we had to then, once the vaccinations came out, we had to do all of that. But that wasn't until 2021. However, so we were doing these things on the street. We had to set up tables. We had to get police to kind of be our backup just in case problems occurred. Um, but mostly we just had a group of people who were trying to get all of this testing done to kind of see where our homeless were as far as COVID infections. So I decided that I would kind of focus on some venues that are inside because of the weather, because of the location of the homeless sites. So you have to choose, just giving you some idea of what my planning process was during this time, as well as some of the lessons that we learned. We had to I went to the communities or to the ward office, the Alderman ward offices in Chicago, and I asked them for help in locating venues. I reached out to our own departments on some occasions to see if we can use some city facilities. So that way we were able to get indoor assessments set up, the enough space where we can socially distance, where we can have electricity, Wi-Fi, as well as parking. Parking was kind of one of the important things because, you know, some of the staff are just not, you know, they're just not able to pay for parking. So we had to figure out kind of things like that. Although we did kind of depend on the agencies to reimburse for that. So it really didn't become a big issue, but I tried to make sure that I made things as easy as possible for those that are going to be working the event. Um, the other thing I had to do is we have, I want to say, about 12 large encampments, but we have multiple, like over 100 locations where individual or small groups are throughout the city. So identifying the large encampments that we're going to focus on that may have like 15 or more, 10 or more homeless on site. And then if possible, depending on how many units, apartment units that we have available, I will also extend it out to little areas, little homeless sites that are surrounding the larger one. And that's just including smaller groups in, hoping that we can get as many people housed as possible. The other issue that we had as far as locations of units is that a lot of homeless, one of the things we found is that if a homeless person is living up on the north side of Chicago, they did not want to or to accept, I should say, apartments that are on the south side. So it was, and vice versa. So it was important that All Chicago and, you know, we're able to get landlords throughout the entire city in order to be sure to service everyone so that they can feel comfortable with where they're living or where they're going. It's one thing to just say, you know, they should be happy that they're getting housing, but the bottom line is, you know, they're as human as the rest of us, and they want to be able to be comfortable where they lived. So that was something else that we had to deal with. Um, the way I handled the clients is that I would have my teams go out prior to the AME. I would have them do a scan of the sites and then the local sites to get the client's name, to get their date of birth, so that we can know for sure who is actually living on site, and then those individuals that we want to add into the event. And the reason I started handling it that way primarily is because we needed to control how many clients we would have at one event. We would have 50 units and 75 people looking to be housed. And a lot of those individuals who came to the event were sometimes referred by outside entities that just wanted to see if their client can do a walk-in and get housed. But we were trying to basically be able to hit every area in the city of Chicago and make sure everyone was served. So we had to control the traffic that came in. So that was one of the reasons we started developing the client list. And also it was pre-preparation work for the actual event itself by putting the clients in the system, making sure their CES applications were completed, and being able to draw from that information and continue on with the client once they were on site. One of the other things that we kind of learned is that with clients and the client list, when they're applying at the AMEs, they really do need to have an ID, because the majority of the landlords are asking for IDs. We were able to connect with a program we have here called City Key, and that helped to at least give them some form of ID to work with the landlord. And then once the client was settled into housing, the case manager who was following up with the client will assist them in getting a more like a state ID, a more federal ID, in order to be able to apply for other things that they're going to need, benefits and employment, that kind of thing. But we thought it was important to deal with that piece of it, because we had to do something, because a lot of people were being denied the housing because landlords would not accept them without. We did have some landlords that were willing to forego the identification, but there were very few and far between. One of the other learning things that we came up with is contact information. Although we work with homeless every day, we know where these homeless are living. We know where they are, panhandling, things like that. Like I said earlier, clients move around a lot. So we had to kind of figure out a tracking system. During the application process, during the process of finding an apartment or assigning an apartment and assigning furniture, um, we always ask clients for contact info, like a telephone number, an email address. One of the things we had to start doing as well is asking for family members who may know where the clients are located when we cannot find them. Um, we've had some situations where clients just disappear on us. They've actually got keys ready. I have one right now. We've been looking for a client for about a week. His keys are ready for him to move in, and he's disappeared on us. So these are the kind of situations that we're trying to minimize by getting as much information as possible. And another thing that we also thought about is the possibility of using, like, I hate to call them, like the temporary phones, I think they are, using temporary phones, assigning them to clients when they come in for the event, or even some kind of, I don't know if these are even possible, the little blinkers that restaurants use sometimes, that when they're ready to be seen, or when they're ready to have their leases signed, that kind of thing, that these blinkers can notify them and let them know that they need to follow up. But, it's just things that people are going to have to agencies are going to have to come up with to kind of improve the process once we're done with getting them the application process, once we're done with assigning them to an apartment, because we want the final piece for them to be housed as quickly as we possibly can. I mean, the goal is I think originally it was 2 weeks, but I think a month right now is probably more reasonable. And another thing is that to consider is involving outside agencies, other agencies. Because I have contact with our delegates, I've kind of invited our agencies to participate with us in the AMEs and to bring their clients. And generally, it's always at the same location that we have chosen to target. We all have pretty much the same client base, and we're just trying to combine the efforts, and including them in this AME process has been very rewarding for them as well as for ourselves. I mean, it was amazing reaction after the first AME we did, and clients and staff were crying with each other about the mere fact that these clients, after being on the streets for so many years, were finally able to get into an apartment. So it was an amazing experience. It tends to still be that way, but it has been great. Just as Christine, next slide. Christine has already kind of given these totals, but just as a reminder, we did have 10 AMEs since December 2020 until this actually last month. Out of that, we had 321 who were engaged, 295 who actually applied, and we've so far housed 211. We have another one coming up in the next 3 months, one each month. So we're just hoping to increase these numbers and hoping to, hopefully make a better life for our clients. So if there are any, this is pretty much it for me. If there are any questions, just let me know. Thank you.
Well, Chandra and Christine, thank you so much. I think it's just astounding what you all and your partners have been able to accomplish here. So I do want to follow up on a couple things. We did have a question early on during your presentation about staffing some of the early shelter locations.
Yes.
Can you talk about those early new shelter locations you brought on board? Can you talk about how you were able to staff those?
Yes. So total throughout this pandemic, we've stood up 8 alternate shelter sites. Right now, we only have one now, but we stood up at one point. It was different alternate shelter sites, 8 different alternate shelter sites. Initially, with the first 3 that we stood up, we actually asked our current shelter providers if they had the capacity, because the majority of the residents were coming from their shelters, if they can staff that facility. So for example, Franciscan, who's one of our largest shelter programs, it was over 200 beds. Because we took 100 beds out of their system, those remaining staff members were able to staff the YMCA location that we had. Also, so that's how it worked. We had a shelter partner in the Salvation Army. They had their own staff. They have a workforce arm that they were able to pull from. And now, and a lot of our different sites were actually staffed. We piggybacked on a contract, a temporary agency contract through the Department of Public Health, and they were the conduit for staffing for a lot of the alternate shelter sites towards the end of 2020, actually to now. The current hotel that we're still in, the one location we're still in, we have temporary staffing there now. In 2020 into 2020, we put out, was it 2020? I'm getting my years mixed up. Yes, 2020, into 2020, we put out an RFP for our shelter providers or providers to apply for to run an alternate shelter. We had one agency to apply, and they staffed this alternate shelter site. So it was different sources for staffing. And as we all know, nationally right now, there's a staffing shortage, it seems like, especially within social services. So that capacity, even within our shelter system now with the surge and so forth, is probably not possible at all.
Great, thank you so much. So I want to ask a little bit about the landlord community and how you were able to, like, this is the thing that most people say makes this kind of effort really hard, is they can't find units and they can't find landlords. Can you talk about how were you able to convince that many landlords to both participate, but also really expedite the process?
Yeah, so it was really about getting the word out. So all Chicago felt that they needed to have a separate arm, a project manager to manage that. So they hired up, and that's where the Chicago Rents division came in. So they were specific to focusing on rent. We got the mayor's office, of course, involved. The mayor sent letters out, publicized on our website, encouraging landlords to participate. And that was part of our initiative, success in our initiative throughout our Ending Veterans Homelessness Initiative. Always getting the mayor involved, and that support is very important. Anytime working with the alderman's office, because they're always saying, "What can we do? Can you get the word out?" And we're still saying that. We're still um, telling people that please get the word out. In Chicago, it's really three sides of town because Lake Michigan is on the east side. So it's the north side, it's the south side, and the west side. The north side is where a lot of the services that the homeless population received, but it's one of the most congested areas as well. So actually trying to find north side landlords is not always possible. So really trying to engage landlords. I remember people saying they're driving up and down blocks to see if there's any for rent signs, talking to the different community organizations within that area, trying to see if they know of landlords who will be open to this population. Also, it was important, there's a landlord contingency mitigation fund, because of course they're not always open to the homeless population, but letting them know that there's case management that comes with this. So there's somebody checking on them daily or weekly. Also, if there's damage to the units, don't worry, you don't have to fix it, we'll fix it. So that helps encourage them as well.
And just a little more context here, some of this stuff like the Landlord Mitigation Fund, the sort of landlord outreach work, you didn't start this when the pandemic started. There's you were able to build on some history that Chicago has with providing some of this, with doing some of this work.
Yes.
So do you feel like, how much did you have to expand that capacity? Like, did you have to sort of, I don't know, double? I don't know how you would talk about it, but can you talk about, like, how much did you have to expand the sort of landlord outreach and landlord relationship capacity, or were you able to just mostly use what was in place already?
No, there was no centralized location for landlords. Like, we have different programs that deal with landlords. So it was using those opportunities and those already programs in place to share with those landlords about this new initiative. Again, like I said, being successful with the Ending Veterans Homelessness Initiative, sending it out to those landlords, like everybody, getting everybody, even our providers, like, are you a landlord? Are you interested? Just trying to get the word out, because people always say, well, what can I do? How can I help? And again, it's about spreading the word about these units, because as I mentioned, the south and west side, it's pretty much predominantly African American. Some people don't want to live there. And there's not as many services on the south and west sides, but it's putting a strategy in place, introducing the clients to these areas. They do drive arounds, they show them what resources, grocery stores are in these areas, show them that it's not bad. You know what I'm saying? So it's actually strategies, I think, taking lessons learned from EVHI that help with this. Like I said, that's where the idea of, like, let's have the mayor do a letter of support, encouraging, let's have the aldermen put this on their website or in their community meetings, talk about it, because that's the people that we need to reach, those in the communities.
That's great. And it's great that your mayor and other political leaders have been supportive. It just makes a huge difference. So I wanted to also ask about, you mentioned some money, $35 million, I think, that you sort of put forward. That you mentioned that was CARES Act money. Was that ESG?
Yes.
CARES Act money?
Yes.
So just want to put a plug in for this is if you're trying to figure out how to use ESG CARES Act money, this is a great example of how to use ESG CARES Act money really well and to make a huge impact. We do have a question in the chat window about whether there's a copy of some of those letters that the mayor or alder people sent, whether you could share those with our audience here.
Yeah, I'll just
so
have to
we
get
can-
approval, but I can definitely send that. And I think I think Norm, I mentioned to you before, I can send the copy of the screening tool as well that was
Yep.
developed.
So
Yeah.
we will post that stuff, whatever we can get together. We'll post when we'll post with these materials when we put them up on the website next week. So thank you so much for that. And I also wanted to sort of talk about the encampment work because, like, I think there's just we're always looking for good examples of sort of helping people go directly from unsheltered experiences into housing. And I know a lot of cities are struggling with how to address encampments. So I have to say that in a lot of cities, the political leaders are very skittish about working with encampments. There's a lot of criminalization that happens in some places and a lot of sort of punitive measures taken against people living in encampments. You seem to have taken a very different, Chicago seems to have taken a very different tack and to really flood the encampments with services and assistance and to focus on housing. Can you talk about how did you develop political buy-in for this kind of very housing-focused encampment strategy?
I'm going to let Chandra talk about her relationships. Chandra, I'm sorry, I just want to really quick, Chandra, I want to give you kudos. Chandra has a great relationship with all the aldermen in the city. They know her and she has their trust. So that's the first thing I wanted to say. Go ahead, Chandra.
I guess it really started maybe, I want to say 7 years ago. We've always had complaints about homeless situations. You have both sides. You have people who are concerned about, the well-being of the homeless and people who are just wanting the homeless to be removed. And I think overall, everyone has a decent feel for wanting to help the people in their community. But I think it was really the aldermen themselves that, with constant engagement, with us constantly educating them on, what homeless need to survive in the streets, what they'll need in order to encourage them to get out of the street. We were constantly having these conversations over and over until finally my department came up with the Encampment Initiative, where, we wanted to kind of look at working with them and giving clients everything that they would need to transition from living in the street and living into their own place. And we were hoping, and it really does work because they get to know us. They know we're here. They know, if they ever need anything, we will be there and make sure they have it. But it was the start of the encampments. And when like I say, I started in 2008. There's a section of Chicago called Lower Wacker. When I began, there were over 250 people living under that area. Now there are roughly about 40. And it was such a major big deal because we were actually giving them giving them everything they needed. And when we came up with the housing piece, that just kind of helped to explode it just getting people off the street, period. So it was all of these different projects that we were doing. We were listening to clients, what they said that they were interested in doing, and we created the low barrier shelter because of that. The encampment piece, bringing all the services directly to them as opposed to sending them somewhere and not, following up to make sure that they did those kind of things. Talking to the alderman, talking to the mayor's office, and letting everybody know that this is, this is what the clients are saying they want. We do work with our Coalition for the Homeless, and they kind of back us up occasionally when we're really trying to get certain services for the clients, making sure that they're not living in squalor, these unhealthy environments where there are a large amount of homeless, a large amount of garbage, uh, rats and everything that are they're living around, and trying to at least keep the areas clean. So it's just that I guess we don't want the standoff, or not to engage them anymore. We want to be able to work with them, and hopefully they can, they'll trust us enough to start moving in a different direction.
Great. Chandra, Christine, thank you so much. This is just an incredible presentation, and I can't say how impressive the results and outcomes of this are. Just, massive kudos to all your work. So we're going to move on to our next presentation here. But if you have a question or comment, please go ahead and put them in the chat window. We're going to move on to a discussion of our ESG/CV spending. I'll do a quick reminder, though, that if you haven't done the poll question yet, there's still time. So go ahead and click on that link. It's just a few sort of comments back up the chain here. But go ahead, and you still have time to answer the poll question. But Sharon, I'm going to turn things over to you to give us our grant status report.
Great, thank you. And thank you to our Chicago friends. I'm the new Chicago desk officer, so I'm very excited to hear about all this exciting work. Maybe I'll get to come see it in person sometime. So we haven't had an update on the ESG/CV grants in a while, but things are trucking along. We have almost every single grant uploaded and ready to go in IDIS, and we have almost 91% of the funds committed, and I'll dig down a little bit in a minute to talk about how those funds are getting committed on which activities. And we're at 33.33% of awarded funds drawn. And it may be hard to see on your screen. I just wanted to show kind of what activities our funds are being committed to and what are being drawn. And so the highest one being homelessness prevention and shelter, and is the highest, and then rapid rehousing. I'm going to go, if we can go to the next slide. Actually, can we go to the next one, and then I'll come back to that one. So this shows where the funds are committed. So you can see in a nice pie chart. So the largest amount of funds are being set aside for shelter at 40%. We have 26% going to rapid rehousing, and then homelessness prevention. And it's been interesting to see, because I think some of these have maybe changed over time in terms of where the focus has been. I think shelter has gone up and down depending on who's working with FEMA and who is not. And that there is now more of a focus on rapid rehousing versus prevention. So I just wanted to share that with all of you. So if we can go back to the last slide, thanks to Heidi Schlipp from Cloudburst for putting this together and doing a lot of our data. This shows kind of where grantees are in terms of their draws. So this doesn't show expenditures, but we only have access to draws in IDIS. So we've got a handful of grantees who are over 80% drawn. But, this kind of looks more like a bell curve, I think, where we've got most folks in the 20 to 40% range. And that there is progress being made, and as the COVID continues, strategy continues to change as well. So it'll be interesting to see how we move forward over time. So I think that is it. If we can go back to the next, I think we're going to go back to the last slide. And I didn't have another slide, I don't think. So if everybody has replied to the poll, I think I am up for sharing the results to that. And I know we don't have as many people on today as usual, but the question today is, how is your community addressing an increased need for isolation and quarantining with the COVID numbers being so high? So it looks like the largest number of you, 10 folks, and you can still reply while I'm talking, see what the numbers change. So 10 of you said we're still exploring options to meet this demand. 8 of you said that you are relocating impacted clients to an offsite location for support. 5 said partnering with other community providers to share designated isolation and quarantine space. And 4 said designating on-site space for isolation and quarantine. So if any of you have things that are working well, please send them our way. We're always eager to hear what is going well, what challenges you're facing. And, you know, we wish you all good luck during this cold and challenging time. So I will send it back to you, Norm.
Great, thank you so much, Sharon. I want to, I think we've managed to answer all the questions we can answer in the chat window so far. So we're going to wrap up here. I want to thank Christine and Chandra for your outstanding presentation and the incredible work you're doing. Just great to see the incredible work you're doing with CARES Act funds. I do want to quickly remind everyone that there is a CARES Act virtual conference coming up. We have the slide up here with the dates of that, and we'll put in the chat window some information about how you can register for that. It's intended for all CARES Act grantees, so we know many of you fall into that category. So wanted to get that announcement out, and I want to thank everyone else who presented and did the logistics and answered questions on our session today. Thanks to the SNAP staff, thanks to our great TA providers. And again, thank you all for joining our session today. And thank you for your continued work on homelessness. Just great to be able to share with you the great work that's going on in Chicago and many other cities around the country. With that, I want to wish everyone a great rest of the day and hope you have a great weekend as well. And that concludes the webinar.